and you should see it here in a second. Are y'all seeing my screen?
Yes. Yes.
Okay, good. Hey, so as I go through this, what I'm going to do, I'm going to talk about case tracking and outcomes reporting and the work we do at FirstCall. So please, as I go through this, I'm going to go through a little bit of a PowerPoint, and then I'm going to go online and I'll show you our test system and really just kind of talk about the approach that we've taken here. And so please, as I go through this, don't hesitate to ask me questions, or if I could learn even more about what you all are doing, that would be great too. But so what I'm going to cover, I'm going to talk about case tracking and what it is that we do and how we go about doing it, and some of the advantages of that, and really what data we're collecting, and then really talk more about outcomes reporting and how we pull data out of our system and how we make it available to our board of directors, to funders, to everything. And then we have a way where we link Excel into our database so we can pull lots and lots of data into Excel so you can work with it using that technology, which is something that I think is really, really useful and easy to work with. So who we are, FirstCall. So we're a nonprofit organization like you all, and we began in 1958, and we really are. Our mission is we help families recover from abuse, so whether that's child abuse or whether that's alcohol abuse, drug abuse. I mean, we are a nonprofit organization that provides counseling services. What makes us a little different is we also have a technology branch, and so that's the area that I work in. I'm the Vice President of Technology, and in my career, I've really just worked on helping organizations use technology, help them figure out more as I grew up as a consultant, and I left the for-profit industry and joined the nonprofit industry in 2002. So I used to work with a lot of large corporate organizations and help them use technology, and then I went into the nonprofit world and I was like, wow, I really got to help. We hardly have any budget, right? We're all kind of just scraping by as a nonprofit organization. So how can we make the most out of technology and really use it as a tool? Because it's, and I love technology, but it's nothing more than a tool to help you all do your job and support you in your mission and everything that we do. So some of the things we've built at FirstCall, more on our substance abuse side, we've created an electronic behavioral health record, and that was really our first time in building a cloud-based, internet-based application that agencies could use to track clients. And so it's called Community Care Link, and it's an electronic behavioral health record. Works great for people who are providing ongoing counseling. We then developed with KU, the KU Area Health Education Center. They provide continuing education across the state of Kansas for medical professionals, and so we built an application for them that helps those professionals track all of their continuing education credits, so they make sure that they stay current with their certifications and everything. And so we built a system that's been running for years for them. And then it was around 2009 or 2010, the Child Advocacy Centers across the state of Missouri approached us, and they took a look at our electronic behavioral health record. They know they wanted a web-based system that they could use as they're serving their clients, their children and their families. And so they asked us to see if we could build something for them. So we really got started in 2010, and we kind of just started with a whiteboard. At that time, I had been in the nonprofit industry for a while, but I really was pretty new to child abuse and how child advocacy really works. And so we really started with a whiteboard. And we started with a group of these advocacy centers, and they talked about, well, what it is that we do. How do we go from a referral to a forensic interview, to building that case and working with investigative MDT members, kind of following that case all the way through, up to and including prosecution. And so we learned from them, and we built a database, an online tool that these advocacy centers are using. So it's been a little while, but we decided, we're doing this for Missouri. Is there ways that we can offer it in other parts of the country? So that's what we're trying to do, is see if it's a fit for other organizations and if it's something you like. But so that's one piece of this. The other piece that I think is really exciting is I really like data, and I really like taking the work that you do on a daily basis and serving your clients and figuring out ways how to pull that out so it helps you tell your story and helps you to really look to, like our grants person, she uses data from me all the time because it really helps her apply for other grants, look for other opportunities, so where we can talk to funders and then report to funders, here's all the work that we're doing. We can show them clinically what we're doing, but then we can also associate a dollar value to it and really show from a business standpoint, we're getting great outcomes with our clinical work, but we're also, we're also providing a lot of financial benefits as we serve the community. So does that make sense?
Yeah.
I'll keep going. So again, jump in if you have questions or comments or whatever. So please don't be shy. Here is the approach that we've taken around case tracking, and I really kind of have it as 3 pillars. There's the referral, which is that initial information that's coming into the organization, and we're really kind of collecting information about the client's family, information about the perpetrators, everyone involved in the client. Then in that middle area is really where we're starting to uncover more information about the case, where we're going through interviews, safe care medical exams, we're documenting the incident or incidents, and so we're really kind of doing more detailed work in figuring out what happened, and then we're pulling together the investigative MDT teams, so whether that's law enforcement's children's division, the prosecutor's office, and we're carrying forward that case, all the way through, potentially through prosecution. I'm curious. So this is the approach that we've been taking. How does this fit what you all do? Is it far off? Is it kind of close?
This is Jessica here. It's pretty spot on with what we do here.
Yeah, same here. It's really close.
Oh, good. Okay. Well, good. See, and all while you're doing that, what that blue bar at the bottom is really represents kind of some ancillary services around client advocacy, potentially mental health, and so you're collecting data as you're going, as you're providing services to the clients, and so kind of outcomes from that are memorized reports and data extracts to Excel. So I'll talk more about that as we go. So here's some advantages of electronic case tracking. Obviously, you can share information easily, especially if it's online. So anytime somebody can get access to the internet, they have access to information. So you can share it amongst your staff members. Potentially, if you're interested, you can share it across, across the state, across a set of providers. You also have a good client history, so you can easily see if this child and their family, if there's been incidents in the past, you have access to that information, and it's easy to see a trail of all the different times that you've served that client and their family because you're recording it online. And then the last thing is you can pull data out, so you can really fairly quickly generate reports that help you identify how well your agency is doing, and again, telling the story about your agency. So those are some advantages, and I've already kind of touched on this, but at its core, here's what we're collecting. We're collecting information about the clients. We're collecting information about the investigative MDT members and the work that they're doing, and then you're also you're documenting the services that you're providing as you go, and recording all of that. So what I'm going to do, I'm going to get out of the PowerPoint for a sec, and then I'm going to toggle over to our online tool. And give me one sec. Let me pull that up. And so this is in our test system. Let me close that. This is really, I've already signed on. Here, let me go back to the home page. So what happens? This is our Children's Care Link, which is our test system. So when you sign on, you have the ability to search, search for information based on the client. You can look up an alleged perpetrator. You can look it up based on your internal case number, as well as if you know your mom, the mom or dads, or somebody who's related to the child, you can do a search on that, and it can show the client's record. How this is organized in Missouri is that I can do a search, like, and this is all play data. So I've made all the clients be colors. Their last names are all colors, so I've just kind of scrubbed all the data. And I've scrubbed all the advocacy center names as well. So you can do a search, and let me filter this a little better, but so for example, you can do a search on Black. You can see that Bailey Black has been served at CAC 26 and Jordan Black at CAC 25. And actually we're going to look at Alyssa Black. So even there, what's happening in Missouri is this is set up so that you can, at a high level, at the very initial set, you can see where these clients have been across the state. So we see that there's, all of these, my fake Alyssa Blacks, and they've been served at all of these different centers around the state. And so when I get to the one I want, I can pull her record up, and so then I start to see her demographic information. So I can see a little bit about Alyssa. I can then see, we've kind of laid out the tabs as really kind of trying to follow the case as it goes through. So from referrals to creating the case, collecting relationship information, interviews, forensic interviews, there's the safe care medical information, alleged perp, and then the section around investigative MDT. And then there's incidents, victim advocacy. So a client, since this is a relational database, if this client had, let's say that Alyssa first came to our center in 2010, and we opened up a case for her, well, then we would see that she had a referral in 2010. She's here in January of 2012, so we see that referral is there. So if a client has multiple incidents with or multiple interactions with your center, you have the ability to collect as many of that as possible. And then when the good thing about this is a lot of the information, there is a lot of information that you can collect on a client, but a lot of the information, not only within a page, but across here, is really optional. So some centers, they want to fill out every single one of these tabs on each of their cases and really try to collect all of that information, whereas other centers, they might say, you know what, we do the referral, we do forensic interviews at our center, but we don't do extended forensics, so we're not going to collect that information. We don't do mental health. We don't provide mental health centers, so we'll never fill out that one. So, they kind of pick and choose what it is that they fill out. One of the key things for outcomes around the clients is that we track where the client lives and where they are at the time of the incident. So when that referral comes in, that's where we record the client's address of residence, and that way, over time, you're collecting this data, and it's really about where the client was at the time that they had that referral and at the time when that incident occurred. So I'm just going to kind of jump through a little bit of this. So once we create a referral, it automatically creates a case for that client. And so then it pulls up a case. And so you have, again, you can have multiple referrals, which link to multiple cases. If a client has, typically our clients come in with, one of the first things that they do is complete a forensic interview. And so you can record, whoops, sorry, I got to select a case. So then you can record a forensic interview on that client. And every document that we are working on now is tied to that case. So we have Alyssa, we have her referral, we have her case, and now any document that I fill out is really attached to that. So it provides the linkage as we go back and do reporting and pull information out on the services that we're providing. So this is our forensic interview form where, we're recording, yes or no, was the interview completed, was it an emergency interview? here in Missouri, they have a goal that if they have if they have an emergency interview, they have a goal for all the centers that they see that child within 72 hours. It's just something that they've set up for themselves. They identify the disclosure, and then this last section is about the recording, taking the recording, releasing it to the police, as well as creating that written report and sending that off to that MDT team and getting the process started. Any questions about this so far? Am I going too slow? You want me to speed up, or am I going too fast?
You're fine. I have a quick question. So this system is linked to every CAC in the state of Missouri?
There's 12 of the CACs in the state of Missouri that use this system. That is correct.
So when they type in the child's name, it will tell them whether or not the child has been seen at another center?
Yeah, we don't. That is exactly right. So what happens, like here, let me do that search on Black again. I'm going to go back to the home page, and I know that I'm signed on as Center 1. So what I can do, what's really neat about it, and they really discuss this a lot because of their their relationship with each other. So let's say I'm looking up, I'm looking for Preston Black. So I see that Preston's there. I can click here. I can get his demographics. I can know that he was served at Center 26. I can look at the referral information. So I can see what happened in the referral. But then when I go to the case information and I try to go forward, I try to go past that, it blocks me.
Oh, it cuts you. Okay.
Yeah, so what they wanted to do, they really wanted to know that Preston was served somewhere else, but they didn't want him to go too far. So then they would pick up the phone or they would send an email to CAC 26, and then they would then they could follow up. Where they really found it helpful is when they've done the alleged perpetrator search. Then they can search, and I think these are colors too. Yeah, so then they can do an alleged perpetrator search and see where else.
That would really be helpful.
Yeah, it's really what was really nice is they got together as a group and said, hey, we all want to work together. We want to use internet technology, so we don't have to buy more software or anything. And so they wanted to do this together. And they wanted to make the record open enough to know that something happened somewhere else, but still protect the privacy of that client.
The confidentiality, sure.
Yeah, exactly, in trying to do that. All right, let me go back to our clients. Oops, I think I missed it. Oh, I'm still searching on alleged perp. Yeah, so it's kind of neat because also with that relationship link, if the family's moving around a lot and you just know mom or dad's name, but you don't have a child's name, you can do a search on that as well. All right, let me go down to the right page. And normally you wouldn't see all of this list, but since I named all the clients at certain colors, I only used like red, black, blue, and green. I wasn't very creative, so we get a lot of them. Okay, so notice how when I go back in, I have to select a case because it really wants to verify that I'm logged on, I'm part of that center, I have the right authority to look at this client's record, and then it also links all of the data to that particular case, which is really helpful. So I won't go through these in a lot of detail, but so like you can collect if there's one or more alleged perpetrators, you can enter information on those individuals. So it's, again, some of these questions are optional, but they're really trying to get a feel for, where they live, what their age range is. If they know their date of birth, that's great. But in most cases, most of the data that I see, they typically don't know the date of birth, and they know just kind of the age range. And that's one of the outcomes that we all track, especially this relationship to the client. So we've really worked on lining all of this up with NCA standards so that the drop-downs match what data they need to pull out for NCA reporting. So everywhere you see drop-downs, we really try to match that. So you record information on the alleged perp, and then that leads you into the investigative MDT section. So you can record information on law enforcement, on children's division, prosecutor's office. If it's a juvenile, if there's child abuse and neglect of the kids, or if it's an alleged juvenile offender, then you can fill out that form. So typically, a case goes from, involves children's division, law enforcement, and then it's really a question if it makes it far enough to end up into the prosecutor's office. And so these are pretty brief forms, but it's really trying to get at, who's working on the case. So these organizations, these are local police departments all around Kansas City. So who's working on the case, and what's the current status of it? And so we can pull reports that show how many of their cases have been referred on, how many of them are under investigated, how many of them were unfounded. So we can pull all of that data for them and give them a feel of, how well are they doing. They can also, as they kind of look at this data, they can say, what, Blue Springs is really good at getting cases moved on and prosecuted, whereas, if we're dealing with, Lee Summit, they all seem to get stuck at under investigation. I mean, I'm kind of making that up, but the data's there for them to do that analysis and see. I'll just touch on these just a little bit. So there's children's division, so it's recording, again, the status of the case. And what's a little bit different on children's division is there's different types of reports. So you can get this as an alpha referral, assessment, documented call, or investigation. And depending on that, the status changes, depending on the type of referral. And I don't know if that's specific to Missouri or not, or if it's just specific to children's division organizations and their cases. Okay, so I really kind of want to get more. I know we're I'm gonna swap back over and talk a little bit more about data. Unless there's more, as you've been watching me, are there more other pages that you'd like me to click on or anything like that? No. Okay, I'm gonna go back. Let's go. Let me pull this back up. So give me one sec. Okay, so what happens? So as we're doing all this work, we're gathering all of this data, and it's key. And so one of the really significant things is that we can pull data out of the system, and we can do it for for many organizations. I mean, obviously, board of directors. You want to provide reports to your board. You want to be able to report to funders, whether that's individuals or foundations. Again, that's when I talk about telling your story. You want to be able to report on, here's all the great work that we're doing, as well as you want to be able to report to certifying organizations. So whether that's somebody coming in to audit you, or it could be reporting to NCA, it's the ability to pull data out of the system. And so, I'm going to touch on a few of these, but here's some examples of reports. Like to the board, this first report, a case statistics report. So here, I'm gonna toggle over. This is a report that you come to this page on the report menu, and you can run this forensic interview case statistics report. And so what it does is the format that it generates you just provide a date range. So many of our centers run this on a monthly basis or on a quarterly basis, depending on how frequently their board meets. So they create this report, and then they export it to Word. So I've already run it. And so here is this report. And so what it's saying for us is that for the month of January, we provided 38 forensic interviews. 11 of them were emergency. We almost hit our goal. We had 10 of 11. On average, we got our kids in within 6 days. Here's the percentage of gender that we served. Here's, our reasons for referral. Here's the age groups of the kids that we that we provided forensic interviews for. Here was our demographics of the kids that we saw. So this first section is really about the kids. And then we have a section about, the relationships of the alleged perpetrator, the age of alleged perpetrators, the number of children served by county of incident. So that's where the incident occurred versus where the child lives. So you can see that like 11 children lived in Pettis County, but 10 of the incidents were in Pettis County. So you have information on that. If you choose to collect it, you can collect information on the disability of your children. And then this is something that we recently added. They wanted to be able to report back to all their different organizations that they're working with how many cases they're seeing. So they want to provide a report to like the Marshall Police Department or the Pettis County. It helps them in their outreach work and really trying to show, here's all the work that we're doing with you and why it's so helpful to work together. Okay, I'll keep going. So that's just a kind of a baseline center case statistics report. At the bottom of this is the NCA statistical report. So this is a similar report that the centers use to report to NCA. So they run this on a 6-month basis, and it's fairly similar. They can run it online. They just put in a date range, and outputs the case information. So again, gender, age, the alleged offender. So they're really answering all of the questions that they need to provide information to NCA. So they can run this. They can go back to past years if they want, and they can continue to run this as at any time, just by putting in different date ranges and outputting it into a Word document. Another kind of interesting report that really gives you, taking it at a kind of a different level. One of the things they do is, so here's this forensic interview case statistics, but one of the reports that they run a lot is this forensic interview report, because it's core. Forensic interviews is core to their process and working. So this report, if you run this on, and I'll just run it for a month, what it does is it'll take this in more detail. So I click Generate Excel, so then it's going to output this in a little bit different detail. So what it's going to do is it's going to give me a list of all of my clients, and then it's going to go kind of client by client, how well did we do, who were the interviewers, so I can get a list of, who were my interviewers for the month, how many kids did they see, did the child make disclosure. So this is really more of kind of an executive director report or a clinical director report. They're using it to see how well they're doing within their organization. And then down below, it provides some summary information on, how well did I do in seeing clients. So how well did I do, like percentage of forensic interviews that were completed within 14 days. So how well did I do in doing that? So it's kind of it's just like a one level below detail of producing a report. So that's a couple of examples of some kind of management or executive level reports. Do you all receive VOCA or SSVF funding?
I receive VOCA.
Yeah, okay. Well, so one example, and I'm going to show this in a couple of ways, but one report that you can pull, this is a VOCA report. So you can run a time report, and so then this can record all of the work that you're doing, and again, I'll just run this for a month. This can record all the work that you're doing as you're providing, as you're entering information into the system. Then it can track all the work that you're doing around VOCA and recording this information. So one of the things it does, so it's running this report. It kind of gives you a preview of it. We can export it. So if we want to send it to Excel or PDF or Word, we can export this report, and I'm going to send it to Excel. And so then it brings it right into Excel for you. So then I can get what we record on VOCA is we're recording the amount, we're recording it by client, we're recording who is the advocate, we're recording how much time we spent, whether it was in person or not, and then we're pulling the gender and race of the client. And then these are all the different types of VOCA services that we can provide. And so we're really just trying to provide this at a, a yes, no, did we provide this service or not? And so we can, since we can bring this into Excel, we can count and we can add these up and provide this reporting on the advocacy services that we're providing to our clients. Any questions about that?
No, thank you.
Okay, I'm gonna let me show you one other thing. So you know again with the different reports you can do that. One of the things you can do is you can link Excel into the database, and so it doesn't matter where your office is. It doesn't matter really where the database sits on a server, because it sits out in the cloud, right? It sits in a data center somewhere. But you can, we've set it up so that you can link your data directly into the database, and so then you can use a tool. Excel has a tool called a pivot table, and so give me one second. Let me pull up this other one. So here is one way of looking at this. We looked at that VOCA report that had, just kind of row after row of data, and it just, it just gave us a list of all of these clients. Well, one of the things you can do in Excel is you can create a pivot table, and it links directly into it. So we've built a bunch of these pivot tables, and the centers use them if they just want to go pull some data. So for example, I have, here's the work I'm doing in 2013. So if I wanted to look at, well, what did I do for VOCA in 2012, I can just click this button, and then it shows the services that I provided for females or males. I could also filter it based off of, I could say, I filter this based on looking at clients that are kind of pre-K, right? So 3, 4, 5, and 6. If I change this to look at all the clients I'm providing services for, so I can see, I can see what that looks like. If I want to look for a particular advocate, I can run and see, what's all the work. Like I have this filtered on Peggy, so I can see all the work that Peggy's doing. So it lets me pretty quickly get a report and just be able to answer questions about, well, what are we doing? What are we doing for VOCA for whether it's male, whether it's female, or whatever. So I can take that kind of same approach, and then I can do a report on, on just like what are we seeing for alleged perpetrators. And so I can show in here, I'll make this, so I have this for 2012, so I can pretty quickly see, what the age ranges of my alleged perpetrators, how many are female, how many are male. I can filter on those, so I can show, depending on what it is that I want to look at, I can see what's happening. I could also say, well, what do my alleged perpetrators look like in Jackson County? And so I can filter on that, and so I can come up with a different slice. So how we use this data is our grants person, if she's answering a report and answering questions, then she uses some of this data, or if she's using it to apply for other grants, that it helps her be able to say, we serve, this many types of clients who are at, with whatever, this disability, this gender, this age, and it lets us apply for more grants because we have this data at our fingertips in order to use it. And so whenever you want to update it, what's kind of fun about it is you can right-click here, you can click refresh, and so what happens is then Excel goes out, and now it's reading the data from the database and it's updating it. So we can put this on your desktop. You can have it set up and ready to use, and then whenever you want to refresh the data for your center, it just pulls it in, and it gives you access to it, and then you can just filter on it. So I know it kind of seems a little complicated, but it's over time we've really had a lot of success with it because we found that many agencies use Excel, And so it's really helpful because you don't have to buy any additional software. You can really just use this tool, and we can bring the data into it. So that's really what I wanted to cover. So I know I went really fast, and I'm not sure if you have any questions or if there's any, if something about technology or just about any of this, if you have any questions for me, that would be great.
What's the price?
The price for Children's Care Link is we license it for $100 a month for a center. And what we did in Missouri, we've taken that same approach, and so what's been really good is all the work that we do, like all the enhancements that we do, once we deploy those, so one center will come up with an idea. Like right now, we're working on a client report, so we just plug that into the software, and once we make it available, it's available to all the centers. So we just keep kind of a long list of enhancements and ideas, and we meet with a core group of people, and they give us ideas for how to keep improving the software, whether it's building additional reports or building additional pages to collect information.
And so if I chose to go this direction, and if I'm the only center in the state of Oklahoma, does that matter?
No, it doesn't matter at all. What we would do is we would set up another instance of the database, and we would have a website. And so there would be a website that you would go to, and you could log on to it. So what you would see would be similar to this. It would actually look very similar to this. It's just what we would probably do is where today it's a Children's Care Link, we might put some sort of branding for Oklahoma, and you would log in, and if you were the only center, then you would be the only center using it. And if if in the future another center from Oklahoma wanted to use it, then that's where you would talk about, do you want to turn on that feature of sharing clients so you could see if your clients were being served somewhere else. We have the ability to turn it on or turn it off, and depending on what it is that you'd want to do.
Wow. Okay.
It's a really, I mean, you can tell I'm excited about technology, but it's really, it's neat that when you can appropriately share information, it just helps the organizations that are providing services to the client. Our other database, we have this collaboration inside of Kansas City for people who are recovering for substance abuse. And we have 27 agencies that do it, and they share data. So if that client is in recovery, and she shows up at FirstCall and tells her story and goes through an assessment, and then we say, what, we really need to send you over to a housing agency, well, then she can go over to the housing agency, and she doesn't have to tell her story again. Her data's there. She can just talk about what she needs to do in her work there. We've also built, not for Children's Care Link, but for the other product, we've also built a web portal so our clients, the clients who are getting services, can actually use their smartphone or their mobile device, and they can see a portion of their client record. But that's not in this child abuse space at all, but it's definitely in the substance abuse recovery space. So do you have any other questions?
I do not. Thank you for all the information. It's been really helpful.
Yeah, thank you both for joining. I really appreciate you taking the time. And you have my email. So if you ever have questions about, about this or, about anything with technology, I'm more than happy to hopefully answer your questions.
Okay. And so if we do have additional questions, we can just email you then, correct?
Yep, that would be awesome.
Great. Thank you.
All right, thank you. I'll talk to you later.
Bye-bye.
Bye.
Bye-bye.